Canada's healthcare system is currently in a state of crisis, with severe shortages of medical professionals contributing to extended wait times and increasing numbers of preventable deaths. The shortage of doctors, nurses, and other healthcare workers has reached critical levels, and the country is struggling to meet the growing demand for healthcare services. In 2022 alone, there were over 143,000 healthcare job vacancies, with the healthcare sector having the highest vacancy rate among all industries in Canada. This shortage is further exacerbated by a rapidly aging population and a system that is overwhelmed by the increasing demand for healthcare services. Nurses, in particular, are facing an unprecedented shortage. For instance, Ontario alone is projected to need 33,200 additional nurses by 2032. Nationally, before the pandemic, the Canadian Nurses Association, CNA, estimated that Canada would require 60,000 more nurses by 2022. These numbers have only grown, with projections indicating a need for an additional 117,000 nurses by 2030. The shortage of healthcare professionals has led to rising wait times for medical procedures, with record-high 27.7-week median wait time for treatments in 2024, according to the Fraser Institute. The growing inability to meet the needs of patients is having fatal consequences. Since 2018, more than 74,000 Canadians have died while waiting for care, and this number continues to rise, with 15,474 deaths recorded in the 2023 to 2024 period alone. One of the key drivers behind this crisis is the shortage of skilled workers, particularly in the field of nursing. As the demand for healthcare services grows, Canada is finding it increasingly difficult to recruit and retain healthcare professionals. The long wait times for treatments and surgeries are causing delays in diagnosis and treatment, and patients are suffering as a result. This is putting additional pressure on an already overburdened healthcare system, which is struggling to keep up with the needs of the population. To address this crisis, the Canadian government has begun taking steps to recruit more healthcare professionals from abroad through the express entry immigration system. In particular, category-based draws have been introduced for healthcare professionals with at least 6 months of experience in specific critical healthcare occupations. These draws are aimed at inviting skilled workers to apply for permanent residency, thereby addressing some of the staffing shortages in Canada's healthcare system. However, while these measures are a step in the right direction, the current pace of the express entry draws is insufficient to meet the urgent demand for healthcare professionals. The problem is not just a matter of numbers. It is also about the critical need for healthcare professionals in certain high-demand areas. While the express entry system is intended to help address these shortages, the number of category-based draws that have been held so far is not enough to fill the vast number of vacancies across the healthcare sector. The healthcare system's current trajectory suggests that the shortage of skilled workers will continue to worsen if more aggressive and frequent recruitment strategies are not implemented. The situation is further complicated by the rapid aging of Canada's population. As the proportion of elderly citizens grows, the demand for healthcare services is expected to rise significantly. This demographic shift will put even more pressure on an already strained healthcare system, making it even more critical for Canada to act swiftly and decisively in addressing the healthcare workforce shortage. To truly tackle this crisis, Canada needs to increase the frequency and number of healthcare-specific express entry draws to attract more international healthcare workers to the country. This will help ease the pressure on the healthcare system and reduce the dangerous wait times that are leading to preventable deaths. The government must take more proactive steps to recruit and retain healthcare professionals to ensure that the country can meet the healthcare needs of its population. The current measures, while beneficial, are not enough to resolve the crisis in a timely manner. In conclusion, Canada's healthcare system is in dire need of healthcare professionals, and the current immigration measures are not sufficient to meet the growing demand. To avoid further deaths and provide timely care, Canada must increase the number of healthcare-specific express entry draws and implement more comprehensive recruitment strategies. Only through a coordinated effort can Canada hope to address its healthcare staffing crisis and ensure that its citizens receive the care they need.
Thanks for watching our video. Please hit the button and subscribe the channel.